Hey, in my previous post I mentioned a very important tool in restorative dentistry, especially for full mouth rehabilitation. It's called the DAHL principle. Actually, it will allow you to open the bite without having to restore the entire dentition. And we owe this to Dr. DAHL, who in the 70s was dealing with difficult cases of deep anterior bites, post and core restoration with high risk of fracture given the configuration of loading when you have a deep anterior bite. So in order to open the bite and remove that deep bite without having to restore the posterior teeth, Dr. DAHL had the idea to create an anterior bite plane. Back then it was using metal, bonded metal appliances, and create a gap between the posterior teeth. Over time, this gap would slowly close by the post-eruptive movement of the teeth. DAHL was opening the bite for millimeters like that. Of course, today we need to open the bite sometime only a fraction of millimeters. I call this the micro DAHL principle. So what we do, we create composite restorations on the linguals of the upper anterior teeth, and we leave this gap created in the posterior teeth slowly close by post-eruptive movement. In that case, you can remove tight bites. You can deal with a deep bite when the upper and the lowers are in very, very tight relationship and the lower teeth are notching the upper teeth. You can open the bite like that, or if you have an edge-to-edge situation, class 3, you can also combine that with deprogramming using a Lucia's jig and the DAHL principle to create more overjet. So it's a fantastic combination of tool, and I'm so excited that we are going to teach that also during our extra wear course.